We were ridiculed when we first did the acute coronary bypass surgery. I was there, and everybody booed us when we presented our first data there.
Pretty prominent people around the country believed that the best thing to do for a heart attack was put him to bed for 6 weeks.
With our approach, we try to correct the problem while there's still time to do it. We were just sort of ahead of our time, I think.
In the early days of medicine in Spokane, cardiac care was not considered a specialty, and it certainly was not a premier practice. But in 1952, Dr. Ralph Berg and his team began researching new ways to treat heart problems. He was a man of precision and expected the best from himself and his team.
If you wanted to work with Dr. Berg, you'd better be impressed and really want to do it, because there was no room for someone who just wanted to hang out. You had to work.
He was very precise and very particular, but very good.
In 1952, Dr. Berg and his team performed the first heart surgery in Spokane at Deaconess Hospital. In 1956, Sister Mary Bede of Sacred Heart purchased the first heart and lung machine in the city, and Berg's team spent years practicing different techniques and conducting lab research with the new equipment. In January of 1959, Dr. Berg, Dr. Henry Lang, Dr. Richard Cleveland, and their team performed the very first open heart surgery in Spokane.
We were all excited. Not really nervous that everything wasn't going to work right. Just excited about doing it and on a person, and it went very smoothly. We had a little champagne party afterward at Dr. Cleveland's house.
Cardiac surgery during the 50s and 60s used early equipment, including the heart and lung machine, manual ventilators, and basic monitoring systems.
Everything had to be put together. It was like cylinders and screws and nuts and bolts and all kinds of tubing to connect the machine to the patient. And at that time, I just had rolls and rolls of tubing that I had to measure, cut, and autoclave. The little discs that go inside, I would have to silicone those and then take them home and bake them in my oven to bake off the excess silicone. And then take them back to the hospital and autoclave everything, and then the morning of the surgery, pull out everything that I'd sterilized and set it up.
We had a ventilator that we called Gasping Gertrude. It was huge, it was big, but she could ventilate the patient. I had to do it manually much of the surgery because as you work on the heart, the lungs come in, and you have to be able to breathe rapid respirations rather than the big breath you would normally take, and that way you could keep the lung out of Dr. Berg's way while he was working.
In 1961, Dr. Paul Shields became the first adult cardiologist in the area. Both Deaconess and Sacred Heart worked to improve cardiac care. The use of defibrillation and pacemakers was a turning point.
Shortly after I came to town, it was recognized that you could do a lot with pacemakers to control slow heartbeat. And that was a fairly common cause of death in many older people.
When they first started, they were about as big as a hockey puck, pretty good size. And they go under here, and you had a great big lump. And they didn't last too long, but now they're much, much better, last much longer, and they're much smaller. In fact, I got one right here. But it's a little thing here, you don't even notice it.
Doctors in Spokane were working to solve heart disease problems in both adults and children. Children born with congenital heart defects were known as blue babies, and the causes of their heart defects were very different from adults.
In adult patients, majority of the problem is coronary artery disease. Whereas in congenital heart defect, there is at least 335 different combinations of defects. It can be half the heart is missing, or it can be one valve is not developed, or it can be one little hole, or it can be anything. So whenever we look at the heart, we don't assume nothing is perfect. We assume everything is wrong. We have to check everything from beginning to the end, to the distal part of it, to make sure that everything is normal before we can say that everything's okay.
Research in both adult and pediatric cardiac care was picking up speed with new technologies available in the 1960s. Dr. Shields performed the first coronary angiogram in Washington State at Deaconess Hospital. Dr. Berg and his team began operating on fresh heart attacks, a practice many doctors in the cardiac world did not agree with.
We did the first so-called acute bypasses here, any place in the world, actually. And people didn't want to believe us that we were really operating on a fresh heart attack.
People thought, well, if you have someone who's having a heart attack, so they come in sick, and then you do this major surgery. You open their chest, you put them on a heart-lung machine, you stop their heart, you operate for hours, you sew them back up. So you've added another insult to someone undergoing a major health problem. How could this possibly be?
Once the surgeons here in Spokane decided, we're not going to just watch that patient here having a heart attack and hope he's going to make it. We're going to give you a much better chance. Why don't we just now make do a bypass? But that takes a lot of guts.
The team learned that bypassing the heart within 6 hours of an attack increased a patient's chance of survival. It would become known as the Spokane experience. But the idea of operating on a fresh heart attack in those golden hours still caused alarm in the global medical community.
In 1975, Ralph actually reported at a major thoracic surgery meeting his first 100 results and giving a one-year history of what had happened to them. And there was a 6.3% mortality in the people he had treated, and in the people who were treated with standard treatment, there was a 30% mortality.
But nobody said a word. I couldn't believe it. And so finally I just stepped down, but the reporters were real interested.
We knew we were right, but you have to understand it was an era dominated by a non-invasive cardiologist.
Over time, the cardiac world acknowledged this improvement in cardiac care and began using the same technique. In 1972, Sacred Heart Hospital set up a 24-hour emergency acute heart attack team. They knew timing was extremely critical for heart attack victims. The Spokane cardiac team was growing throughout the 70s and 80s. One major problem still remained in the global medical community. Cardiac specialists could not agree on the cause of a heart attack.
It was actually Dr. Rudy, together with Dr. DeWood, one evening, so I was told, who were in the operating room at that time. And I don't know who said to whom, but said, hey, wouldn't it be kind of nice to see if it's really a clot? And so they took a tiny little balloon. It was like a really tiny long balloon, and they pushed it inside that artery where they made an incision, and they inflated the balloon and pulled that clot, and they came out of the hole that they made. And what came out there, they were all surprised. So, wow, and there is the clot. And the whole world, within a moment's time, was convinced, my gosh, it is actually a clot that causes a heart attack.
The Spokane team had done it again without the support of a major university. These doctors were changing the world of cardiac care outside of a major research institution. This discovery forever changed how the world treated cardiac disease. By the 1980s, Spokane cardiologists were using catheterization rather than open heart surgery to correct some heart problems. But for other patients, opening the chest cavity was the only way to help. And in 1986, the Spokane team conducted its first heart transplant. The team was evolving, and so was technology.
The 80s were probably mostly the decade where cardiac surgery, perfected how we were doing things. And then I think the 90s became a time where we started thinking about how can we make it easier on the patient? How can we be a little less invasive?
Doctors began using new technologies such as lasers and ablation practices in the 1990s.
Electrophysiology essentially is analysis of the electrical signals of the heart, and that has to do with rhythm disturbances, heartbeats that are too slow, hearts that go way too fast meaning in the order of 250 beats per minute at times. And there are young people who have these rhythm problems. They've been born with short circuits.
At the turn of the century, surgeons began using less invasive techniques. They performed robotic surgeries and transcatheter aortic valve replacements to improve patient recovery.
Prior to that, the only way to replace an aortic valve was to open the patient, stop the heart, remove the bad aortic valve, and sew in a valve surgically. And that's still the standard procedure. But the catheter valve allows us to put a valve that is inside a stent, crimped very small, can go through the groin up the artery to the heart, and then put in place inside the patient's bad valve. It literally just pushes the bad valve out of the way, and the new valve is in there. We do that without opening the chest, without stopping the heart. The difference is dramatic. I mean, an 89-year-old who we might have operated on before and might not have survived, or might have had to go to a nursing home for, 2 months, maybe never strong enough to go home, or, a major difficult recovery. We literally do those patients now and they go home in 2 days. And they're patients that we wouldn't have operated on before. We would have just thought they were too sick and would have just been denied that new valve, or patients who would have gotten a valve but would have really struggled to recover. We're now doing 200 of these procedures a year.
Today, Spokane cardiac doctors continue their quest to improve the lives of their patients. This simple goal has been the main priority of the team since the 1950s, and it will continue with every patient yet to come.
There's something about the town and the team that we have continued to be able to recruit excellent people here.
What we have here is special. I think you really build it one by one, person by person.
Dr. Judge used to say, use the mother rule to take care of patients. Take care of that patient like they're your mother.
The moment you invest, time and energy in getting to know this patient, you will be rewarded 100 times.
The mother said, I want you to know that you gave my daughter an anesthetic when she weighed 3 pounds. I want you to be a part of the fact that she's graduating from high school today and this is what she looks like. So one of those in a lifetime makes all the rest of it worthwhile.
I just think so much of the hospital because they gave us what we needed, We got what a wonderful institution. There isn't a hospital in Seattle that's got what we got here.